How to cure sinusitis naturally. First part. As my dear YouTube friends are in this opportunity, we will talk about what sinusitis is and how to cure it naturally. What is sinusitis? Sinusitis, sinus infection, acute and chronic sinusitis or rhinosinusitis is an inflammation of the paranasal sinuses, usually caused by an infectious agent. This infection can be caused by fungi, viruses, or bacteria. These affected sinuses are bone cavities that are found in the facial mass. These cavities are filled with air and communicated with the nostrils through drainage holes, ostium. So it is common the association of nasal inflammation and sinusitis, hence the correct thing would be to speak of rhinosinusitis. Precisely, the key to the development of a sinusitis is the alteration of the drainage ostium that causes mucus retention inside the affected sinuses. Types of sinusitis. Sinusitis is divided into two types, acute and chronic. In very general terms, these types are defined by the period of time that the symptoms persist. But there are other important differences in how many symptoms, causes, and treatments. Acute sinusitis, it can last a maximum of 8 weeks and its most common cause is infection by bacteria. Chronic sinusitis is determined in this way when it exceeds 3 months of symptoms. Here, bacteria are as common as fungi, which cause infections that are harder to treat. Symptoms of sinusitis. Symptoms of acute sinusitis. The first symptoms of an acute sinusitis may occur approximately 1 week after the patient suffers from an untreated or insufficiently treated cold, which makes the symptoms worse. The most common symptoms are headache, annoying pressure that can be painful in the area of the eyes, the gums and cheeks. Pain over the affected breast is intensified with physical effort. Obstruction and/or nasal congestion, usually bilateral but that may occur unilaterally. Anterior and posterior rhinorrhea of whitish or yellowish-green coloration, purulent rhinorrhea, and loss of olfaction. High sensitivity in different parts of the face. Sometimes moderate fever. Halitosis, bad breath. Pain in the dental arch. Sore throat. Cough, especially when you try to sleep. Retronasal drip. High fatigue during the day. In most cases, acute sinusitis responds well to usual medical treatment, but there are approximately 1/3 of cases that do not. Symptoms of chronic sinusitis. In the case of chronic sinusitis, the symptoms are less obvious. Presenting some symptoms such as nasal obstruction, persistent mucoid rhinorrhea, hiccups, tubal symptoms, etc. Causes of sinusitis. There are a variety of causes that could be causing sinusitis. Therefore, a detailed study by the otolaryngologist is necessary to determine what may be the cause that really affects the patient. Among them we have the allergy, alterations of the cilia, vasomotor rhinitis. In general terms, sinusitis occurs when the openings, ostium, of the sinuses are obstructed and mucoid secretions accumulate in the paranasal sinuses. This situation means that bacteria can grow more easily. Among the most common causes we find infection and inflammation of the nasal ciliary mucosa that causes an alteration to lead the mucosa outside the paranasal sinuses, causing obstruction. Allergies and infectious rhinitis. Obstruction of the paranasal sinuses due to excess mucus when suffering a cold or severe allergies. Obstruction of the paranasal sinuses due to anatomical problems, such as a deviated septum, hypertrophic turbinates, a nasal bone spur or the appearance of nasal polyps. In children, hypertrophy of the adenoid tissue should be added. Risk factors for sinusitis. Beyond the causes that sinusitis may have, it often originates through factors caused by the patient himself. Among the risk factors that have the greatest influence on the development of sinusitis, we find to have submerged in contaminated water, exposing infectious agents and microorganisms to the organism and especially to the nose. Smoking, a habit that thickens the mucous membrane and makes obstruction in the sinuses easier. Allergic rhinitis. Cystic fibrosis. Changes in altitude where the pressure is considerable, whether diving in depths or traveling by plane. Immune deficiencies, often caused by HIV/AIDS. Development of tumors in the area of the paranasal sinuses. An excellent home remedy for sinusitis is to clean the nose and sinuses with a mixture of warm water and salt. Since it helps eliminate excess secretions and reduces inflammation, relieving symptoms such as pain and pressure at the level of the face. The nasal washing technique is excellent for cleaning the secretions of the upper airways. But it is also an excellent way to keep the nose clean, being useful for those who have a respiratory allergy, rhinitis, or sinusitis. How to decongest the nose when you have sinusitis. Perform a nasal lavage for sinusitis is an excellent home remedy to help in the treatment and relief of nasal congestion symptoms. They characterize sinusitis, helping to make secretions come out more easily. If the nasal wash is done after a nebulization, the results will be better. Ingredients: 1 teaspoon of baking soda, 2 teaspoons of sea salt, 250 milliliters of warm boiled water. Preparation method: mix all the ingredients until a homogeneous solution remains and keep it in a tightly covered glass container. With the help of a dropper, place 2 to 3 drops of this saline solution in each nostril and place the head back, letting the liquid penetrate the nose and reach the throat. This nasal wash should be done 2 to 3 times a day for the duration of the disease crisis, being ideal after a nebulization. It is also possible to perform a nasal wash with a syringe with physiological saline bought at the pharmacy. Or prepare a mixture of a glass of warm mineral water with 3 tablespoons of diluted salt. Tap water should not be used because it can cause an infection. Other tips to uncover the nose. Other tips to uncover the nose are: use a humidifier or vaporizer in each room of the house. Drink about 1.5 to 2 liters of water per day, since water helps dilute mucus. Place a wood under the mattress to keep the head elevated and facilitate breathing. Use warm compresses on the face to relieve discomfort and open the sinuses. 1 home remedy for acute sinusitis: nebulization with eucalyptus. A good home remedy for acute sinusitis is inhaling eucalyptus vapor because it has expectorant and antiseptic properties, quickly relieving nasal congestion. Ingredients: 5 drops of eucalyptus essential oil, a teaspoon of salt, a liter of boiling water. Preparation mode: place the boiling water in a panella and add the eucalyptus oil drops with the salt. Then you must cover the head and panella, inhaling the steam of the tea. It is important to breathe the steam as deeply as possible for 10 minutes,